Hello, my name is Ashley Baker, and today I'm going to be demonstrating how to remove a Foley catheter. So before I began, I did perform hand hygiene, and I did assess my patient's level of consciousness to person, place, time, and purpose. She is not in any pain, but she is eager to get the catheter out, so that's what I'm here for today. She did not have any questions or any new things to inform me on. So I do have all of my supplies. The only thing I don't have over here that I would be sure to have would be a basin to place the catheter in once I am finished removing it. And I have already obtained the urine sample, so we are ready to remove it. I did assess for any bladder distension, and it's not distended, so we are good to go. So just going to don my procedure gloves, and for demonstration purposes I only have one set, and that is in my package over here. So I would have my procedure gloves on now. So we are going to position her with pointing the sheet up towards her and having her place her legs, bending her knees up. And on this side, just having her place her knees up if she does not roll off the bed. And so I will pull the sheet up, okay? She's kind of running away from me. So I'm just gonna help her place her leg up just a little bit. So wrapping the sheet around and tucking under her foot. That way whenever I pull it up, I have a clear line of sight. And then on this side as well. Okay, it is kind of playing with me. Just gonna unclamp it from the bed and make sure my tube is not caught behind her leg. So now I will expose the area. And the sheet is giving me a little difficulty. It is giving me a little difficulty today. Now, okay, so the tubing is in the crease of her leg. So we're just gonna get that situated. Okay. Now, of course, we are ready . There we go. So Miss Sally's blanket has decided to work with me now. So now I would remove my procedure gloves and I would perform hand hygiene. And I have discarded the urine out of the bag, and I have obtained my sample that I needed. So hand hygiene, and going to open my package. So I'm going to don my procedure gloves, and these aren't sterile. So just normal non-procedure gloves. Of course, you never could go wrong with using sterile gloves because they are specifically made to be sterile. So then I'm going to grab my drape that I'm going to place under my patient. Again, shiny side down. And I would have her raise her hips, but for demonstration purposes, I will be just placing it. And I do have my syringes, and I do have 2, because this is a 5 milliliter, but sometimes more than 5 gets put in. And then it's easier to use a 10 than to have some, like on the 10 milliliter ones, it's just best to have 2 10s. So just being over prepared. So we're going to withdraw from the bubble, making sure that it's completely deflated, because we do not want to pull the bubble out of her urethra while it's still inflated. That would not be too good. So just removing, I do have 4.5 milliliters right here. Just going to grab my other one just to be 100% sure. And going to withdraw. And I'm not getting anything out of there. So, just gonna remove it. Then I'm going to instruct her to take a few deep breaths while I remove it. So, you just pull straight out, deep breath, and then here is where I would discard it in the basin that I was talking about earlier. But for demonstration purposes, I do not have one. So, we are going to just discard it in the biohazard bag, trash can. And then of course I would change my gloves and perform peri-care. We want her as clean as possible and prevent UTIs and such. Then of course I would remove my drape, ask her if she's in any pain, and then I would lay her back down, ask her if she needs anything, come back and check on her in a little bit. But for right now, I'm just gonna lay the sheet back down, make sure she's comfortable, and get the triangle out of her face. Make sure she's comfortable. And then in a little bit, I would make sure that she goes and pees before she leaves, of course. If she's not feeling up to it at this minute, I would give her just a few minutes to situate after the procedure was done. And then we would get up and go void in the bathroom. So we don't want to send her home, of course, if she can't void on her own. Then I would clean up my supplies and come check on her in a little bit, remove my gloves, and hand hygiene. Thank you.